Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan, and today our lecture comprises of an introduction towards the subject of ophthalmology. Now, how do we basically go about and define the subject? It's basically a branch of medicine and surgery that deals with the diseases or abnormalities that we diagnose in the eye. So that is basically known as the subject of ophthalmology. The usual features that are included or that are diagnosed while we are practicing ophthalmology are the abnormalities usually with the visual acuity. Now, how do we go about and define the visual acuity? It's the clarity of the vision, in other words, or in layman terminology that we define visual acuity. So while we study ophthalmology, we should know background or history towards this subject, who were the well-known scientists who contributed towards this field, and what were the advancements in this field. So that is what we're going to learn today. The evaluating complaints will also be discussed over here in this very first section. And along with that, we'll be discussing the history taking. That is the prime focus while we are practicing ophthalmology. What are the different kind of diseases that we commonly encounter as an ophthalmologist? We'll be discussing them as well. So in the second section, we'll move on towards the epidemiology, that is relevant towards the eye diseases or towards the ocular pathology. So we'll be discussing that over here in this section, and we'll be focusing on the causes of these illnesses. So what are the peculiar causes and towards these peculiar illnesses that are well known to an ophthalmologist, and then the prevalence of these eye diseases or ocular pathologies will be discussed over here. And then we'll also discuss the incidence of these diseases in different populations. So in the third section, we'll be focusing on vision primarily. How do we define vision? It's basically the clarity of sight, which is regarded as vision. We'll go about and basically know the factors which are responsible for a blurred vision. And then we'll move on to the color vision. How do we diagnose a problem with the color contrast vision phenomena? What are the different causes of blindness? Will also be discussed over here in this very third section. Moving on to the fourth section, we'll be discussing the ocular pathologies over here. How do we document these ocular pathologies? Obviously, there is a special way to document pathologies for every speciality. That is also true with the ocular diseases, and working as an ophthalmologist, you should know what are the common terminologies being used, what are the common illnesses that we encounter. The photographic evidence is sometimes quite well established in this field, and it has its own manifestation. So we'll be discussing what kind of a photography is required that is specific for this ocular pathologies. And then we'll move on to the factors to consider while we are practicing this branch of ophthalmology. Then in the very fifth section, we'll be dealing with the age-related changes in the eye. So one of the most important age-related changes is the macular degeneration. So we'll be discussing that over here. And then we'll discuss, first of all, the causes that are relating towards the macular degeneration. Moving on, we'll be discussing the risk factors that are related to the development of the macular degeneration. What is the sign and symptoms that are specific for this macular degeneration? That is obviously the clinical manifestations of this disease. We'll be discussing that over here. And then the prognosis of macular degeneration, that will be discussed over here in this last and the final section. So I hope you want to learn more about the branch of ophthalmology. So do watch the other sections to this lecture as well.